Okay, it's great to have you guys here. So hello and welcome. I'm going to be going over a quick startup presentation to welcome you all and introduce you to our program if you have not attended a session with us here before. My name is Astor Castro and I am the Chief of Diversity here at Pre-Health Shadowing. And thank you all for attending. So Pre-Health Shadowing is a student-led, minority-led, women-led nonprofit organization that is dedicated to helping prospective healthcare professionals gain access to educational resources and get involved in the medical field, no matter demographic status, abilities, or location. So a quick PSA, we do have closed captioning for all of our sessions to accommodate students with disabilities. The setting is at the bottom of your screen. If you need help enabling it, please, you can direct message me or any of one of my team members, and we can help you out with that. So since we are really aimed at being accessible and inclusive for all students, if you have more ideas about how we can do this, please email us at info@prehealthshadowing.com. We're always open to suggestions for growth. So since this is an international program, we want to know, where are you Zooming from? So please go ahead and drop in the chat where you're at today. Awesome, we've got people from all over. Singapore, wow, okay, thank you for joining us. That makes me feel it's just so awesome that we have so many people coming from so many different places. So we would just like to let you know to stay in the loop with us and keep up with our sessions and what's going on in the Pre-Health Shadowing community. Make sure to follow us on Instagram and TikTok. We are active on both those platforms. And then also make sure to go to our website and sign up for our email list. And you will get weekly emails that just update on when our sessions are and what events we're putting on. Don't worry, we don't spam. We only send one email a week, just with the updates for everything. So I recommend that if you want to stay in the loop. So we have some wonderful opportunities for you all as benefits of being part of our program. First of all, we have partnered with Kaplan to get you guys a 10% discount code that can be used on all Kaplan products, as well as access to free resources such as study guides to help you prepare for standardized tests like the MCAT, the NCLEX, the PCAT, the GRE. If you fill out our short survey, which is just dropped in the chat, you can get hooked up with this stuff, and it's amazing and it's a great resource, so I highly recommend checking it out. We'd also like to draw your attention to another amazing program, which is Neolith. Neolith is an online mental health platform for students and who are going through things right now. I mean, we're in a global pandemic, and college and young adulthood is already stressful enough as it is, especially for pre-health students. We know the path isn't easy, so that's why we partnered with Neolith to get you guys free access to their services. If you use the link in the chat or use the code PREHEALTH when signing up, it'll be absolutely free. So we have some more exciting stuff down the line with them, so I urge you guys to get involved right now. So another thing we have is Mask for Mask. Mask for Mask is an amazing woman-led organization that donates 4 masks for every 4 masks sold. These go to people in need during the COVID-19 pandemic. Those include those in the homeless community, healthcare workers without proper PPE, and really just anyone who is struggling to stay safe right now. With our discount code, PHS15, you can get 15% off your order if you buy through this method. And 10% of the proceeds will actually go to Pre-Health Shadowing too, which is amazing because we are a nonprofit that runs solely off of the support and work of our students. If you would like to play a bigger role in Pre-Health Shadowing and support our program, we would love for you to join our network of student volunteers and team members. You can apply to be part of our administrative team and lead students in various projects with initiatives such as professional outreach, grant writing, and graphic design. We also understand that as pre-health students, this may be kind of difficult. We don't have a ton of time on our hands. So we also offer asynchronous volunteer opportunities, which you can get for accredited volunteer hours, and you can do it on your own time, at your own pace, and contribute to the program through your own unique perspective. If you are a high school student, we got you covered too. We have started a new program called HCP, which is High School Training for Pre-Health Shadowing. And this allows high school students to network with different colleges, professionals, and also get involved with opportunities at a pre-collegiate level, which is really great. I mean, that's going to help a lot on applications, on future resumes. So if you are interested in connecting with the college students who are currently leading the pre-health shadowing team and seeing how you can get involved at the high school level, I encourage you to visit our website and sign up as a volunteer and indicate that you are interested in HCP. So we want to recognize the work of all of our hardworking students in the program. So if you are interested in getting published, you can submit essays, reflections, research papers, and reviews to our editor-in-chief, who is Mutaha, who will be one of our wonderful co-hosts here today. And the link is in the chat. So to look great on CVs, applications, resumes, etc. So I highly encourage you guys to take advantage of this. So just another update, we are starting some diversity initiatives. This month is Women's History Month, so happy Women's History Month, everybody. But also we are going to be doing more diversity outreach and focused events in light of the world we're living in right now. So if you want to nominate professionals or people you know to be speaking on diversity panels this month, obviously since Women's History Month, at the last weekend in March, we will be having some incredible women professionals come and speak about their recognition of female disparities in healthcare and just their experiences as professionals in being women in the field. So if for this panel or future panels that we may have, if you have professionals you would like to see speak at these, give insight, if you have just feedback and contributions that you want to give to this, go ahead and fill out the form that was just sent in the chat. And we hope to get some of your input there. So we humbly ask that if you can, you donate to our program. As I said, pre-health shadowing is a completely student-run organization, and we are working around the clock and around the globe to keep this running and free and accessible to everybody. Unfortunately, Zoom and our website are not free. So if there's any contribution you can make, even just $1, $2, $3, we would very much appreciate it. If you're not financially able, we completely understand. And we just request that you share this link, spread the word about our organization to people you know. So make sure to drop your questions in the chat throughout the session. We will have a Q&A portion in the second half. And we just want to make sure that you guys get your questions answered and you get what you came in here for today, to network and get the advice from a mentor. So with that being said, make sure you take good notes, because at the end of the session, I will be reviewing how you can earn a digital certificate verifying your virtual shadowing hours that you earn here today. So stay tuned for that. Last but not least, please, if you can, put your cameras on. This just makes it more of a personalized environment. It makes us feel like we're actually here, actually shadowing, actually getting to connect with each other, because I know that we probably all sit behind our computers most of the day staring at little boxes on Zoom. So if we can, we'd love to see your faces. You can go a long way, but completely understand, no pressure. So yeah. Thank you guys so much for joining us today. I'm going to hand it over to our professional, Dr. Gupta, if you would like to go ahead and start sharing your screen.
Hi, everyone. Happy Monday. I hope everyone's having a good day. So, you know, I am an allergist immunologist in New York City. I saw that some of you are from New York, so that's nice. And this is my Instagram handle, so please follow me at NYC Doctor. And if you have any questions or anything like that, you can always email me too. So, you know, I always like to start off with this quote, which is, "The days are long, but the years are short. So enjoy every moment." This is just so true in life in general. And I just want you guys to remember that, because I know you're sitting there and you've heard this before and it doesn't really make sense, but it's just true. When I look back and I see all of your faces and I can just see, yeah, I just remember being that young, and I'm not anymore. And so I just want you guys to enjoy it. And just remember that, you know, the process of getting into medical school or nursing school or physician assistant school, it can be scary, it can be daunting, but at the end of the day, your path will, it will go the way it's supposed to go. And I truly believe that. So, you know, everybody needs to stress out a little bit, but I just want you to not get too stressed out. And so I'm really glad that that you guys are partnering with an organization that can help if anybody does feel overly stressed out for any reason, because, you know, if you're not mentally and physically strong, then you're not going to be able to help other people. So it's really about taking care of yourself first. So that being said, I'm going to talk about my journey, choosing your path, what's allergy, immunology, and then 2 case studies. Might not get through both of the case studies, but we'll try. I also have a 7-month-old who my husband is going to try to put to sleep tonight because I'm doing this. And so if he continues to scream and it doesn't seem like it's going well, I might have to just stop for 5 minutes just to put him to bed. So let's see. So this was my path. Undergrad for 4 years. I went to the University of Michigan. I saw a lot of you are from Michigan too. I did biopsychology and religion as my as a double major, just so I could get a little bit of just, you know, some, instead of just doing all science, I had a chance to you know, take some really interesting religion classes, and then went to medical school for 4 years at Michigan State University College of Human Medicine. At Michigan State, there's a MD program and there's a DO program. So the College of Human Medicine is the MD program, but they also have a great DO program. And then I did residency for 4 years because I did internal medicine and pediatrics. It's a combined residency training. I'll talk a little bit more about that at Rush University Medical Center in Chicago, which I absolutely loved. And then I did my fellowship here in New York City at SUNY Downstate in Brooklyn. So, you know, the other thing that I want to talk to you about is that choosing your path is not easy. So, you know, first deciding, do you want to become a physician? Do you want to become a nurse? Do you want to become a physician assistant? Do you want to become a nurse practitioner? There's so many different ways that we can become healthcare providers, and so many different ways that we can help people, and it's hard unless you really shadow. And so I'm really glad that even during COVID times, you guys are getting an opportunity to at least talk to you know, people in the healthcare field and just understand different paths that you can take. So shadowing is just very, very important. And then in every specialty, you want to remember that there's different ways to practice. So meaning that you could practice in an academic setting, which is like hospital based. You can do, you know, private practice, which is mostly where you work in an outpatient clinic, or you can do telemedicine, which I think with COVID and everything that's going on, unfortunately, we're all very familiar now with telemedicine. And you can do a combination of all of these things. So you can do one or all three or two. And so it's really important to remember when you're shadowing people and you know, understanding what they're doing, that there's lots of different ways of practicing the same field. And then even within one field of medicine, you can focus on one area within a specialty, or you can just broadly practice the specialty. So for example, in the space of allergies and asthma, some of my colleagues only like really focus their care on asthmatics, so that they're just super specialized in asthma care. Others might be really interested in the skin aspects of allergy care, so they're super focused on helping patients with skin disorders like eczema and urticaria. I myself am a true Libra, so I kind of like to do everything. I like to have balance. So I've done, I haven't really specialized in one particular area within allergy and immunology. I see adults and kids, and I see everything within the space. And then I said I was going to talk a little bit about med-peds. So med-peds is when you're trained in both internal medicine and pediatrics. So internal medicine is, you know, from, so actually pediatrics is from birth until 18, and then internal medicine is from 18 years of age till death. So, you know, it's adult medicine and kid medicine, right? And you can either do a residency in internal medicine by itself or pediatrics by itself, and each of those is 3 years. Or you can do something called Med Peds, and it's 4 years, and you're trained in both. So you can take both the internal medicine boards and the pediatric boards. And then that also means that you can subspecialize in any specialty within either internal medicine or within pediatrics. So it kind of just really allows you to have more of a broader spectrum in what you can do. And just, you know, I really wanted to see adults and kids. So this worked out well for me. It's different than family practice, because with family practice, you would do maybe some obstetrics, and also you can't really subspecialize in as much with family practice as you can with either internal medicine or pediatrics, or the combination. So, you know, what is allergy immunology? Well, it's, you know, even if you're trained in just adult medicine or just kid medicine, actually, if you do a fellowship in allergy immunology, you end up seeing both. So that's another reason that I did Med Peds, is because I knew I wanted to do allergy and immunology, and I knew I wanted to be comfortable in seeing both adult and pediatric patients. You treat patients from head to toe. So I really like it because of that. I see people with, you know, issues with their eyes, issues with their nose, issues with their breathing, food allergies, skin allergies. And so it's really encompassing, I feel like, where you get to treat conditions that affect a lot of different organ systems. So, you know, one of the bigger, so I'm going to review 2 cases that we generally see in on a day-to-day basis. So the first one is a 41-year-old male who presents with recurrent means, you know, frequent cold-like symptoms, upper respiratory tract infections, which are present year-round, but generally flare up in the fall and winter. Joseph often travels for work and states that staying in a hotel or cleaning make his symptoms worse, especially if it is dusty. He is frequently on antibiotics to treat his upper respiratory tract infections during the fall and winter time. Joseph has tried the following for the past 3 months with limited benefit. He's tried saline rinses, steroid nasal sprays, and over-the-counter antihistamine drops for 3 months, all with limited benefit. So this is a lot to kind of take in, but this is, you know, so essentially this person has recurrent cold-like symptoms, which means they have, you know, a frequent runny nose, congestion. And that's what upper respiratory tract really means, is that the upper respiratory tract is the nose, throat, chest, and or sorry, just the nose and throat, and then lower respiratory would be more of the lungs. And so, you know, he tends to have a lot of basically cold-like infections, and they're present year-round. So a lot of people, when they have allergies, think that they just keep getting colds over and over. And it's not until we test them that we find out that actually they're allergic, and that's why they're having these kind of cold-like symptoms. And that's another reason, you know, with allergies, I personally have a lot of allergies. So I have allergies of my eyes and nose, I have eczema, I have asthma, and that was another reason that I went into this field. And when you have allergies, you really understand what it means, because a lot of people will say, oh, allergies are not a big deal. You know, you're not going to die from your allergies. That's not true with asthma or with food allergies, because unfortunately you can. But with seasonal allergies, it's true. You're not going to die from your seasonal allergies, but it's very, very uncomfortable, and it causes a lot of disruption to people's lives. People miss a lot of school, kids miss a lot of school because of their allergies and the discomfort from their allergies. Adults miss work, and it can cause sleep issues. So it can really affect people's lives when they have allergies. And so it's a quality of life issue, which is important in a lot of conditions, to remember that quality of life is is a really important thing. Like I was talking about at the beginning of this lecture, you know, your everyday existence is all that matters. And so if you're not feeling well frequently, then your quality of life is going to be poor. And so, you know, this patient travels a lot for work, and cleaning make his symptoms worse. So maybe he's allergic to dust mites. And he also seems to have more infections during the fall and winter, which is a common time to have colds, right? So it could be because he's getting recurrent viruses, or it could be because of his allergies. So let's see what else happens. So Joseph's prolonged uncontrolled symptoms like congestion and conjunctivitis may have also contributed to sleep issues. So congestion is just, you know, when your nose feels plugged up. Conjunctivitis is, so we have, you know, the white part of our eye is the conjunctiva, and when it gets inflamed, so conjunctivitis means that the conjunctiva is inflamed, itis. So itis, I-T-I-S, means inflammation. So when you see that at the end of any condition, then you can say, okay, so what's the beginning of it? And then the end of it means inflammation. So this is where the, you know, the white part of the eye is irritated or inflamed. And that's essentially what can happen with allergies. So Joseph has never been tested for allergies. On his exam, his turbinates, so turbinates are essentially tissues in the inside of our nose. We can see our turbinates. So when I look in your nose with just like a light, I can see these tissues inside of your nose. They're like little balls kind of on the inside, you could say. And those balls should be just pink and not too big. And when you have allergies, they can look what we say pale, meaning that they're not as like pink, they're like a lighter pink, boggy, which means that they're just super full, and then bluish in color. So they can be like a pale blue instead of a nice pink color. And we also noticed that he has watery eyes, and he's got injected eyes. So what that means is that his conjunctiva is red, so is irritated. And so that's what we mean by eyes that are injected. An office skin prick test revealed positivity to grasses and dust mites. So grasses, you all know, grass is a pollen that is released. So the pollen of grass, is released in the summertime. There's also tree pollen, which is released in the spring. And then there's fall pollens, which are weeds. And so, so if you have a tree pollen allergy, you're going to have symptoms in the spring. Grass is mostly in the summer, and then weeds are in the fall. So that's kind of the way to break those kind of things up when you're seeing patients in clinic. And then dust mites are actually this tiny little mite that we can't see with our naked eye. So you can't see it walking around, which is a good thing, because actually dust mites live everywhere. So no matter how clean you are, you still are exposed to dust mites. They live off of the flaking of our skin. And what that means is that they're most commonly going to be found in our bedding. So in order to get, and we're not allergic to the dust mite itself, we're allergic to their droppings. So we're allergic to essentially their poop. And so in order to keep your environment free of dust mites, you want to wash your sheets in hot water at least weekly. You want to make sure your pillows aren't too old, because if your pillows are old, then the dust mites, what they do is they go inside the pillow and they poop on the inside of the pillow. And so the entire inside of the pillow is just full of dust mite poop, which for somebody that's allergic will make them really sick. And so you can get dust mite covers for pillows. And what the dust mite covers do is they prevent the dust mite from going inside the pillow and pooping inside the pillow. So it protects your pillow from becoming just a dust mite poop pillow. And so, people can get dust mite covers to help protect them, and protect and help decrease their allergies. You can essentially get dust mite covers for the entire bed, but I think the pillow is the most important area that you need to protect. So that's your little education on dust mites. And then, important things to remember is 40% of Americans suffer from environmental allergies. So what we mean by environmental allergies is allergies to things like trees, grass, weeds, dust mite, cockroach. Same thing with cockroach. We're not allergic to the cockroach itself, but we're allergic to its droppings. Cats, dogs, we're allergic to their dander, and then mold. Or mice, people are allergic to mice, and we're allergic to their droppings and to their urine too. So, that's what we mean by environmental allergies. There's also food allergies, but that's totally separate. For environmental allergies, the symptoms are usually a runny nose, right? Because you get those, the turbinates, the inside of the nose, those tissues get irritated from the allergen exposure, and that causes those tissues to become leaky, and that causes a runny nose. You get the itchy eyes because the conjunctiva, or that white part of your eyes, gets irritated and inflamed, and that causes them to be itchy. You get congestion for the same reason. With the turbinates, you feel tired because your body's constantly in this irritated state. You can also get rashes if you have eczema or from your allergies. So for example, I'm allergic to cats, and when I'm around cats for long enough, I'll have a runny nose, itchy eyes, congestion, I'll feel tired, I'll start getting itchy all over, and that'll cause me to have a rash. It'll make my eczema worse. I also have asthma related to allergies, so it'll cause me to cough and wheeze. And, not everybody that has environmental allergies will have all of these things. So when you have the runny nose and congestion, that's called allergic rhinitis. So remember, rhino means the nose, and itis means inflammation. So rhinitis means nasal inflammation. And then the itchy eyes is the allergic conjunctivitis. I don't know why I'm having issues saying that word. I say it all the time. And then the rashes again is eczema, and the coughing and wheezing would be asthma, would be allergic asthma. And so, but not everyone will have all of these conditions all at once. Some people only suffer from allergies of their eyes. Some people only suffer from allergies of their nose, or you can be like me and suffer from all of them. So how do you make the diagnosis of allergies? You can do an allergy skin prick test, which is what this patient had done. So this is not, this patient is not the same patient that is in the case. This patient actually has multiple allergies. And so what we do with skin prick testing is we take this device. It's like a plastic device that we dip into a bunch of serums. So the serum has the proteins that people are allergic to in the serums. And so we test people to all the different things that they can be allergic to. And here in my office, I usually test for 70 different allergens, environmental allergens. So there's lots of different types of trees, depending on what area you live in. There's lots of different types of grasses. So we check different types of trees, grasses, weeds, the dust mites, the cat, the dog, the cockroach, the mice. And if you're allergic, your body will release histamine. So when we put it on that plastic device, we prick those protein serums on the top layer of the skin. So we're not putting the allergen inside your body. We're just kind of irritating the top layer of your skin to see if it responds to the allergen. And if your body is allergic, then your body will say, oh yeah, we don't like this. And your body will cause mast cells. So mast cells are a type of blood cell that that's present in our skin and can cause the release of histamine. So when you're triggered by your allergen, it causes your body to trigger mast cells. And once mast cells are triggered, that causes the release of histamine. And histamine is the main thing that causes issues with allergies. And what histamine is it's a chemical that causes irritation and inflammation all over our body. And again, depending on what part of your body you get irritated on, that will cause these different symptoms and the different conditions. And so that's essentially skin prick testing. Blood IgE testing is, so IgE is the antibody, even like that is triggered with your allergic reaction. So the IgE antibody is a type of blood cell that is floating around in people that are allergic, and it's specific to the certain things that you're allergic to. So what we can do with the blood test is we can say, we can take your blood out and we can tell the computer to look for IgE antibodies to different proteins. So we can tell it to look for cat protein, dog protein, tree protein, and then if you're positive for those things, then that means you're allergic. And then that's what happens. So the body has those IgE antibodies, it sees the protein, the IgE antibody then says, oh yeah, we don't like this. Then that causes the release of mast cells. Then that causes what we call degranulation of the mast cells and the release of histamine, which then causes the inflammation in your body. I should really put a diagram of that because I think me just talking about it is probably confusing, but it's but that's essentially the pathway of what happens in an allergic reaction. So, you know, once you know what you're allergic to, we can really guide environmental measures, like what I said for dust mites. If you're allergic to dust mites, you can do the you know, washing your sheets and getting the dust mite covers, and, you know, cleaning and vacuuming and all those kind of things, getting rid of rugs. If you have a dog, we're not going to tell you to get rid of your dog. I learned that a long time ago, is you will lose patience if you tell people to get rid of their pet. So, you know, once you diagnose a pet allergy, there's different things that we can do. For people that are really sick because of their pet, it can actually cause very severe asthma. For people that are allergic. And so it can be dangerous. And, you know, if it's to that level, then sometimes I really do recommend, especially if a small child is having allergic asthma and is having a really difficult time, I will really sometimes guide the parents to get rid of the pet. But for people that are having milder symptoms, we can also do something called immunotherapy. So immunotherapy is a way to desensitize your body to the things that you're allergic to. And so what we do is there's different ways that you can desensitize the body. You can use something called allergy shots, which are injections that you get on a weekly basis for 6 to 9 months. And then it eventually goes to monthly shots. And the reason that the process is so long is because at the very beginning, because these are things that you're allergic to and can make you very sick, we start with a very, very small quantity of the allergen. And slowly, every week, if you tolerate the dose, then we increase that dose weekly. So the first week we start off with, so we make different vials of the allergen. So this patient would have, you know, a grass vial and a dust mite vial. If you're allergic to 20 different things, you're not going to have 20 different vials. We know through lots of studies that we can mix certain allergens together. So we can mix all of the pollens together and nothing will happen to the proteins. However, if we mix, for example, cat with mold, no, cat and mold can go together, but there's certain things like cat allergy cannot go, the cat allergy protein cannot be mixed with trees, for example, because that cat protein will start degrading the tree pollen protein. So there's certain things that we can't mix together, but usually if you're allergic to almost everything, we'll make 4 different vials for you. And so that means someone could technically get 4 different allergy shots weekly to desensitize them. And so immunotherapy is a great way for people that are really allergic. So that's the allergy shots. And then there's also sublingual immunotherapy. And what that means is sublingual, so under the tongue. So sub, under, and lingual is tongue. So sublingual immunotherapy that we put under the tongue. And there's a tablet form that's FDA approved. And then there's some people make drops that aren't FDA approved. But so I usually just use the tablets if somebody doesn't want to get shots. So those are all just ways to make your body less allergic to the things that it's allergic to. And as a side note, immunotherapy really works for environmental allergies. For food allergies, we're just starting to kind of understand how we can build a person's immune system and make it less sensitive to food allergens. But that's a very new area that we still have a lot to learn about, but there is something called oral immunotherapy for food allergens. But you can't do any kind of food allergy shots. There's nothing like that. It's only for the environmental allergens that we can do shots. So now going back to Joseph was asked to continue. So treatments. I didn't really talk about treatments, but essentially, the key thing is that there's a lot of inflammation, right? So steroids, which I know you guys have all probably heard of what a steroid is. A steroid is an anti-inflammatory medication, and it can come in many different forms. Nasal steroid sprays are often used for allergies because a lot of the inflammation is centered around the nose, where you first encounter the allergen. So the nasal steroid spray will help reduce some of that inflammation and make those turbinates not as irritated. And remember, the nose, the inside of the nose has little cilia. Cilia are just like little moving hairs that kind of clean out the air. So it's kind of our filter. The nose is kind of the filter to the body. So if the nose gets really congested and irritated, then we don't have a good filtration system, right? So we really want to protect the nose as much as possible. And so that's why the nasal steroid sprays really work. There's also an antihistamine nasal spray. So remember, histamine is the chemical that causes a lot of that inflammation in allergies. So there's an antihistamine or anti-against histamine nasal spray that we can use for allergies that works right in the nose. And then there's also daily, and then you can also do antihistamine pills like Allegra, Zyrtec, Claritin. You guys might have heard of some of these things. And that just blocks the histamine throughout the body. So those are really good to use too. And then there's also antihistamine drops that you can use just for the eye, for the conjunctivitis. And then we told him to do environmental control measures since he was allergic to dust. And at 4 weeks after we started him on these treatments, Joseph states that he starts to feel better. So usually with nasal steroid sprays, because it's an anti-inflammatory, any kind of inflammation. So let's say you get cut, right? Let's say you scratch yourself on your hand and you get kind of like redness and swelling. You know that even if you apply medication to it today and you're really good about taking care of it, that swelling and irritation it naturally takes time for it to go away. There's no way for us to magically get rid of irritation and inflammation quickly. And so I always tell my patients, and if any of you have allergies and have tried nasal sprays, a lot of people will get nasal sprays, but they won't use them correctly. So they'll use them for 2 or 3 days, and then they'll kind of give up on them and say, oh, this isn't even working. But really, none of the nasal sprays are going to work that quickly. You have to give it time. You have to give it at least 3 to 4 weeks before you're going to notice a difference in your symptoms. So that's really important with patient education, that when I'm starting people on treatment, that I give them some kind of parameter to know when they're going to start feeling better. If I give them medications and I don't give them education behind when they're actually going to start feeling better, then they're inevitably going to stop using the medication because they don't believe that I gave them anything that would work. But if I tell them, because it doesn't work quickly, right? But if I tell them it's going to take 3 to 4 weeks for you to feel better, then they understand that, and they understand what to expect, and they'll continue the medication and see, and kind of do it through to the end to make sure that they get the full benefit. So, and that's true in any condition. You really want to make sure that you're, you know, guiding the patient on their treatment, and make sure that you're providing education on when they should expect to feel better. And so again, allergy shots, and it's also called subcutaneous immunotherapy, because sub means under, and then cutaneous means skin. So subcutaneous, under the skin, immunotherapy. So allergy shots was discussed. However, Joseph travels for work and didn't feel that he could commit to getting shots. So another way that we say allergy shots is subcutaneous immunotherapy. So SCIT or SCIT. So, coming in weekly to the office because he works, because he travels for work, would not work for Joseph. Since Joseph feels an exacerbation of his symptoms during seasonal changes, but also feels miserable year round, I started him on a dust mite pill, the sublingual immunotherapy pill. And that's called Odactra, just so you guys know. So this is where I kind of talked about immunotherapy, but I already ran through this with you guys. But one thing I didn't mention is that, so when we're desensitizing the body to allergens over time, we have a Th1 and a Th2 type response in our body. Th1, T helper cell type 1, are the non-allergic response in our body. T helper cells type 2 are responsible for the more allergic responses in our body. So what we want to do is we want to change the immune response from a Th2 response in an allergic person to a Th1 response. So that's essentially what allergen immunotherapy does. Allergen immunotherapy is not a cure, so it will reduce your symptoms. And that's important to also tell patients. So with allergy shots, for example, we would continue the monthly shots for at least 3 to 5 years. After that 5 years, it doesn't mean that once you stop allergy shots that you'll never have symptoms again. So we really have to counsel the patients on that too. Some patients after 5 years, if we look at them 5 years later, a third of them will still be doing great, and they'll still feel like, oh my God, my allergies are just still great. I don't have my symptoms. A third of patients, however, will start feeling some of their symptoms after 5 years of stopping shots. And then some patients will say, you know what, I'm right back to where I was before I started shots. So unfortunately, we don't have any way of predicting where somebody will be. And so for some people who feel a lot better with allergy shots, they want to just kind of continue taking the monthly shots indefinitely, and that's okay. And that basically is just like getting booster shots to make sure that your immune system knows the right way to react to allergens, because they don't want to gamble and have to restart allergy shots, because when you restart allergy shots, you have to go all the way back to the beginning and start the weekly for 6 to 9 months, and then go to monthly shots. Which patients benefit from immunotherapy? People with allergic rhinitis, which is inflammation of the nose again, allergic conjunctivitis, which is inflammation of the conjunctiva, allergic asthma, inflammation of the lungs, atopic dermatitis. Atopic means allergic, and dermatitis, so derma means skin, and itis means inflammation, right? So dermatitis, so allergic skin inflammation or eczema can also respond to subcutaneous immunotherapy if we see, like, for example, for me, I'm allergic to cats, and I know that every time I'm exposed to cats, I will have an exacerbation of my eczema. So there's a direct correlation. When a patient has a direct correlation to their eczema and to their allergen, then the immunotherapy will work. And then, so in children, if we start the immunotherapy early enough, then it can prevent them from going from allergies of their nose to allergies of their airways. So usually the progression in children is that they'll start with allergies of their nose, and then over time, their lungs will also start reacting. And so in order to stop that progression of the allergic disease, starting them on allergy shots can help prevent them from progressing into just allergies of their nose to allergies of their lungs or asthma. So it's a really important thing to consider for kids. And so, okay, so again, subcutaneous allergy done weekly, then it increase, and then they're given for 6 to 9 months weekly, and then it goes to 3 to 5 years. The drops or the tablets we talked about. So there's a dust mite tablet, a ragweed tablet, and a grass tablet. And then the FDA does not regulate the allergy drops, and there's mixed use on the data. Okay, so it is 8:20, and I think we have time for questions, and maybe I'll come back on at some point and we'll do asthma another day. But I hope that you guys learned something.
Yes, thank you so much. That was a wonderful presentation so far, but we can for sure get to some of the questions that we had. So one of the first questions was, is there anything that you did not expect when you were going into allergy and immunology, and what were some of the most notable things that you learned in medical school?
Okay, that is a loaded question. So as far as things that I didn't expect with allergies, so I don't really know. I mean, I think the other thing to consider when you're trying to decide what kind of field you want to go to is a lot of people want to go into allergy because it's a relatively nice specialty in that you're not going to be called into the hospital for an emergency procedure. So if somebody's having a reaction, like a food allergy reaction, for example, then they would go to the emergency room and the emergency room doctor would treat them. But however, if you're a surgeon, if and one of your patients has a complication and you're on call, then you might have to go into the hospital to take care of them. And so, those are all lifestyle things that you have to remember when you're picking a field. And so for me, I really didn't have too many surprises with allergy. With the field of allergy and immunology, I kind of knew what I was going into, but that's also because I really took the time to shadow a lot of allergists and really understand. And it's not like I knew from day one that I wanted to do allergy. At one point, I thought I wanted to be a cancer doctor or an oncologist for kids. And then I realized that for me, seeing like children with cancers, even though I would feel really fulfilled treating them, it really affected me too much. And I realized that for my personality type, it was not healthy because I would really take all of that sadness and that stress home with me every night. So when I did my rotation in the oncology, in the peds oncology unit, I just realized that it was just too stressful for me and it just made me too sad. I couldn't really find that balance to understand that, that people get sick and that that somehow it can be really sad and bad. And so you have to really understand what your personality type is and see what what kind of conditions you are going to feel comfortable dealing with every single day. And if death and dying is a hard topic for you, you can still be in medicine, but you might not want to pick something where your patients have a higher propensity to die, right? And so in allergy and immunology, like I said, it's more of a quality of life issue. Although, I have had patients die from asthma. It's not that it's not that common, right? And the patients that did, they fell off of, therapy for whatever reason. They didn't come back. There's lots of different reasons. Sometimes the asthma is so severe. Sometimes they come into, at a point where their asthma is so uncontrolled, and then they have a severe exacerbation before we can get their asthma controlled. So you can die from allergies. You can die from food allergies, unfortunately, but all of those things are more rare than, somebody, if you decide to become an oncologist, you're going to see death and dying more frequently. So those are just things to remember as you're trying to pick your field of medicine.
There was a student who asked how your work-life balance is. So this question, you can talk about your personal work-life balance in your career and like the general field of allergy and immunology, like what kind of paths can people take?
Sure. So like I said, my work-life balance is actually pretty nice because, again, I don't get called into the hospital late at night. And if I'm on call, so what it means to be on call is that, you have a pager, or you're on, now most people don't carry pagers. We just use our cell phones, and they message us on our cell phones to tell us that somebody wants to talk to us. But when you're on call as an allergist, mostly you're just answering patients' phone calls. And if they are having issues at night with their allergies or their asthma, or any kind of issues with any of their allergic conditions, then they might call you and you can give them advice over the phone. So that's the only time that I'm really working overnight. Now, I made a huge transition as I didn't really talk about that in the beginning, but my personal practice, I actually am doing a lot of telemedicine now. And so I actually just, I co-founded a new telemedicine company called Get Cleared. So it's getcleared.com. And essentially it's an all allergy telehealth company. And so now I'm kind of working from home, to be honest. And it's been great because I can work from home. And, a lot of what I'm doing now is not only just seeing patients over telehealth, but I'm actually building this company. So that's another thing in medicine. Once you have the knowledge from going to medical school, there's so many things that you can do with it. And there's so many people that want to kind of change the way that medicine's practiced. So they need a doctor to help them understand the condition, to help them understand how they can build a telemedicine company, to understand how to deal with patients, what medications. So all of this stuff that my co-founders don't understand, right? My co-founders are business people. So they need a doctor if they want to build a medical company. And that's, I got introduced to them through somebody, and then I started this path, and now I'm a co-founder. So there's so many different ways that medicine can take you. And so that's really important to remember too. So if you're a business-minded person and you really think, oh, I want to do this and that, you can still do all of those things. You can be an entrepreneur as a doctor, or as a nurse, or as a pharmacist, or as a physician assistant. You can really use the knowledge that you gain from your training to do whatever you want. So yeah, that's what I'm doing. And I'm also opening my own practice soon in Brooklyn. So, you learn a lot, and you realize that there is a business side of medicine too that you have to be aware of. And so I want you guys to really think about that well-roundedness in your education. Now is the time that you can take lots of different classes, which is really fun. When I was in undergrad, I took a lot of religion classes just because I was interested in it. But, if you think that you're interested in business, for example, now's the time to kind of take a couple business classes, understand stuff about business, stuff about technology. This is really the time to explore other things too. I know we kind of sometimes get stuck and we think, oh, I'm going to be in science, so I need to only do science classes. But I actually think that you're going to learn everything you need to in medical school. I promise you. They will cram it into your head. They will shove it into your brain. And so, you definitely, you have to take all of the pre-med classes, all of the pre-nursing classes, all of those kind of things you have to do to get into graduate school. But I would really encourage you guys to pursue other kind of interests that you have outside of medicine, because now is the time to do it. Like, you're really going to be in training for a long time. You're going to get that education, so you don't have to worry about that. But you're never going to be able to, never is not the right word. It will be harder for you to take business classes later because you'll be so busy with medical school or with nursing school or whatever. And so just something really important, I think, to remember. Also, I didn't get to this, but I actually, after my fellowship, I took 2 years off. So I finished medical school, I finished residency, and I finished my allergy fellowship. So I was a fully certified doctor. I could, go out and start making money and practicing. But instead, I said to myself, okay, I'm finally done with this path. I haven't taken a break at all. And so I took a break, and it wasn't really a break. I volunteered as a doctor in Africa, Nepal, and India for 18 months. So I was gone for 18 months. I also backpacked through Southeast Asia during that time. So 12 weeks out of that 18 months, I was acting like a 25-year-old, even though I was 32, or no, 33 or 34. I was hanging out with all of you guys, 25-year-olds, 22-year-olds, backpacking through Southeast Asia. And it was amazing. I got to see China, Thailand, Laos, Cambodia, Singapore, Malaysia. And I really, I lived it up, and it was great. And then I came back, and I'm still a successful physician. So you can take breaks and still be successful, and still, and I have a child. I got married. For all the women on here, you can have it all. You can take breaks. You don't have to. I think in America, especially, there's very much a pressure to, buy a house, have a kid, get married. There's a system to everything, that you're supposed to reach goals at certain ages. Okay, well, I had my first child at 42 years of age, and I'm okay. He's 7 months. I'm able to take care of him. My body still feels great. I still feel great. Now, there are, obviously, you have to prepare for that. Obviously, 42 is older to have a child. It's not old, but it's older to have a child. So, there might be issues. And, but then there's things like IVF, and there's other ways to have children. So there's a way to make everything happen. So I don't want any of you to feel pressured in finishing things at a certain time, doing things at a certain time. It's really about the moment. It's really about enjoying life. And if you're not enjoying life, then really there's no purpose, right? The purpose of life is to enjoy life as much as you possibly can, and to bring joy to other people. And that's really what you're trying to do as a doctor, right? The one other thing that I always tell people, and I know I'm not answering your questions, I'm just blabbing on, but these are things that I want you to know. The one thing that I always tell people is that, and I lost my train of thought, but it's, it's just important to enjoy life. And especially now with COVID and everything that we've seen over the last year. I mean, I personally have lost 3 family members to COVID. And so it's, we notice that there's a fragility to life, and you really have to enjoy the moment as much as possible. I mean, we all go through things, we all get sad, and that's normal. But at the end of the day, what we do for ourselves and others is what's most important. And yourself and caring for you is very important too. And I lose track of that sometimes too, because I think when we're type A personalities, which I think all of you are, if you want to go into healthcare, you tend to want to do everything. And that's me, right? Like tonight, for example, my husband's not happy that I'm giving you guys a lecture because I should be spending time with my little baby, right? But I like doing this. So, you know, you have to find balance, right? You have to find balance in everything that you do. And so, so yeah, so I want you to remember all of that. And I want you to remember that there's different paths and you don't have to always follow the path that you think you need to follow. Um, so yeah, that's it. I'm off my soapbox.
Thank you so much. That was not at all like rambling or anything. That was something I think a lot of people needed to hear and wanted to hear, and that was so honest and open and personal. And so I thank you so much for coming on and sharing that with us.
Yeah.
That meant a lot to me as somebody looking to go into healthcare, and knowing that you can follow different paths, you can do different things, you can still be successful, and it doesn't matter where you come from, what you're doing, or I don't know. That was just really powerful. But kind of go off of that a little bit. Do you think that having a degree in religious studies affected your practice as a doctor? And do you think it's, I mean, you did kind of answer the second part of the question, which was, do you think it's important for medical professionals to also have a good foundation in social sciences and maybe like political or international relations in addition to traditional biology, like biology
Yeah, and
courses?
I think I answered that. And, you know, I think the religion background, I'm not an expert in religion, right? So I didn't focus on any one religion. I think sometimes, you know, your undergrad degree, people are like, oh, you religion, so you should know about this and that. I'm like, no, I don't. I just took a bunch of religion classes that I wanted to. I took Women in the Bible. I took a class on Islam, Judaism, and Christianity, a comparative class. I took, you know, Islam and politics, which was really mind-blowing when 9/11 happened, because it just really brought to light everything that I learned in that class. So, you know, it's it really did provide, it helped me learn about, I think religion is a foundation of a lot of political issues, life issues, you know, international issues. So but it's also the thing that can, that's so palpable. Like when people have religion in their lives, there's lots of studies on this, that when people have religion in their life and they believe in something, that it is really a powerful thing and it can heal, right? And so a belief in something beyond the here and now is a very powerful thing. I personally, like my husband and I, he's not Indian, I'm Indian. But, you know, in our household, we kind of are not atheists, but we kind of are like pan religion. And I don't know if it's because of, you know, my religious background, you know, doing religion and just all my interests in religion, and my husband's just quirky like I am. But you know, we have like a Buddha in our temple. We have Jesus, we have Virgin Mary, we have Ganesh, we have Saraswati, we have, you know, Muhammad. We have all of these like pictures and like deities and things that we collect from different parts of our life, and we have them all in this space. And so, you know, religion can be so many things to people, and or people can have no religion, and that's okay. You know, you can believe in whatever you want, but that belief system is really powerful. And so yeah, to me, it, you know, it helped me understand people's belief systems, and also just for me personally, I feel, like I said, religion, most religions are the same thing: be a good person, you know, take care of others. And that's kind of the message that most religions give you in different ways. And so I always say that, like, you know, it's just a different way of bringing that message to different people, and different parts of the world needed to hear it in different ways. But yeah, so yeah, I do think it helped me. I think it helps me understand patients better, people better. But yeah, you can do that in so many different ways. You can do that through understanding. Yeah, if you're interested in dance, you know, I'm also a dancer, so I took a lot of dance classes in undergrad, but it just because it made me happy, right? The other thing that I want to quickly talk about is meditation, right? And so meditation is big right now, and it's all over the media, and it's all over like Instagram. Everyone's trying to meditate, but there's a reason for that, because there really is a lot of data, medical data, to show that meditation is really important for our brains, and we need to rest, because unfortunately our brain doesn't rest very often anymore. When we sleep, people oftentimes have restless sleep because of all the screen time that we have, and we're constantly being inundated with information because of our cell phone. And so it's just important to rest our brain, and we're seeing more and more data on that. So I really like, maybe another relationship that you can make with an organization is one of the meditation apps. Maybe you guys can get, some kind of a discount or free membership to a meditation app, because I really encourage you all to find, like Headspace, or there's so many of them now. Calm is another one. But really, I want you guys to find something, because medical education and the whole system, and like the kind of stress that you go through to get to becoming a doctor, is intense. And I'm not going to lie to you guys, it is very, very intense. And so I want you guys to figure out how you're going to cope with that stress now, right? I want you guys to figure out, is it going to be exercise? Is it going to be dance? Is it going to be meditation? Is it going to be a combination of all of them? I know for my 7-month-old, I've already I'm not a good meditator, but I want him to be a good meditator. So I'm already starting to have him sit with me when I'm doing my meditation that I try to do as much as possible, but I'm not good at it. So I'm not going to lie, is I do a singing meditation that has these arm movements too. And that's the way that I can get my body, my mind, to calm down and not to think about my list of 50 million things that I need to still do. And that's really what, meditation is supposed to be. It's supposed to calm your mind so that you can let go of your thoughts, and not go down that rabbit hole of, oh shoot, I didn't do that. And then if I didn't do that, that means I haven't done that. That means, oh no, I haven't finished that. And that kind of constant cycling in your brain doesn't allow your brain to rest. And so that's what meditation is really for, is figuring out how you can stop that kind of constant cycling of thoughts. So, there's a lot of good data on it. It's not this kind of weird thing. It's actually supposed to be very, very helpful. So I encourage you all to think about that too. But exercise can be meditative too, right? If you run for long distances, you can become focused and in a trance. And if I dance with my eyes closed and I'm really loving the music, I can get into a meditative state. So there's lots of different ways to meditate. Just remember that too.
Thank you so much for sharing. I think as pre-health students, we often put our mental health and our rest as a second priority, or not even a priority as all, so it's really important. There's a question which says, there has been research done in which those in developed countries tend to have more food-related allergies or environmental allergies compared to those in developing countries. Do you think this is true? And can you explain the immunology behind this?
Yeah, so I mean, it is true, right? The data supports it. And during my work in Africa, I did not see food allergies. And so it's, there is something to it, but it's a very hard thing to study. So research studies have to be very they have to be very controlled, and it's very hard to control a whole country, right? And to figure out what is it within that ecosystem that's causing something to happen. And so it's really hard to figure those things out. But some of the theories are the hygiene hypothesis, which means that, quote unquote developed, I don't like using that word really, but developed countries are cleaner, right? We're focused on bleaching everything and doing all those things. And so is it that our immune system early on is not exposed to as many natural environmental allergens and things like that, so that your body is really learning, my baby his immune system is learning, what is my natural environment? What am I supposed to react to and what am I not supposed to react to? And so some people say that if you aren't exposed to enough things that you react to, then your body gets confused and it needs to react to something. And then it starts reacting to environmental things like dust and trees and weeds and things like that. But, that's one hypothesis. And it's just, again, it's very hard to study because it's very hard to control for those factors and to control for them long enough to really see and make sure that somebody is following that exact path, right? And so, so it's a difficult thing. I think with food allergies, I think me personally, I think it's a lot of the way that we process our foods, the way that, for example, we want things to grow faster, to grow bigger, to we need instant gratification. People want to just, everything needs to be bigger and faster, bigger and faster. And so we genetically modify our foods, our plants, right? Like the plant of the food to make whatever. And when you genetically modify things, then that can, in my opinion, our bodies naturally are like, is this normal? What is this, right? It doesn't look natural anymore. And so that's one of my theories. And so I think, I think that is obviously more in developed countries where we're genetically modifying our food and things like that. And so I think that might be part of it. And I just want to say that, physicians, we call them like martyrs. And I think we do have an issue with like martyrdom in healthcare. And that just basically means like, I'll sacrifice myself for, everything else. And like you said, that's not good, right? And that's not good. And if you sacrifice yourself and your own personal health, you really will not be able to help others. And I've done that so many times. Even last week, I made myself so stressed out that I literally was starting to feel sick, like I was physically sick. And that's when I just said, okay, something has to change, something has to shift, because my body doesn't feel good. And you have to listen to your body. You have to listen to your mind. You really, really do. Because if you stop listening, it will come to a point where you'll get to that state like I was last week, where you just can't function, and then things will slip, right? And you'll mess up on a test or something like that, right? And so you just want to focus on keeping yourself healthy. I think that's like one of the most important things that you can do for yourself, for your patients, for your family, is just taking care of yourself. And that doesn't mean being selfish, right? I don't want you to be selfish, but I want you to listen to your body.
Thank you. That is so important to remember. And it's just such great advice to have, to know that we do have to take care of ourselves before we can take care of other people. I mean, that's just a fact in life. And so keeping that in mind and moving forward into these what can be really draining careers is important. So thank you for sharing that. One of the questions we had is, since you do obviously, you work with pediatric patients and adults, how do you deal with parents who may not comply with the recommended measures for their children who are dealing with allergies, and how do you work and manage that?
Yeah, so I mean, like, I've had an issue, and you have to kind of ground yourself, when you have a parent that seems to like their dog better than they like their child. And it is hard, and you have to remember not to judge, right? Because and that's something that I really struggled with and continue to struggle is, we know a lot about our patients, and oftentimes we make preconceived like opinions about people, and that's wrong, and that's not good. And that's why we have so many issues in healthcare. And so you really have to check yourself. I consider myself a very open-hearted, kind of very sensitive, very like kind person. I consider myself those things, but sometimes my preconceived notions and like things that I bring into a room are not okay. And so, so you always have to check yourself. And I think in that situation, you know, I don't know what that dog means to that person. And dogs, now we know, animals are very therapeutic for people. And it doesn't mean that that person doesn't like their child or that they're trying to hurt their child or whatever it is. It's that, you know, they can't imagine life without either thing, right? And so how do you balance that? How do you protect the child but also understand the circumstance, right? But also make sure that the person, that, you know, the parent understands the potential gravity of the situation. So it's just kind of, you know, making sure that you're not judging, making sure that you're informing, making sure that the person, making sure that you're doing your best to guide the family in the right way. And then beyond that, you know, you have to let go and you have to just make sure that you're giving the right medications to protect the child if, you know, the allergen is not going to go away. So, yeah, and I think, you know, obviously if it becomes really scary, then there's different measures that you can take, and, you know, like calling child protective services. I mean, I've never had to do that for an allergy, but for like somebody keeping an allergen in their home. But if it became bad enough, I could do that, right? Because it's causing a lot of harm to somebody that doesn't have a voice. So yeah, so as a pediatrician, as a child doctor, you learn a lot about those kind of things, about, you know, child protective services and your role as a pediatrician to protect, you know, a child that can't speak up for themselves. And so that is a big role as a pediatrician that you play.
Thank you for sharing that. I think everyone can learn from that and see to recognize their own biases and look at things from their patient's perspective, which is really important. There's another student who asked, how do allergies emerge and evolve over time? They say that they knew someone who developed severe food allergies later on in life, so they didn't have in their childhood, and they developed it in adulthood.
Yeah, so allergies can actually develop at any time in your life. You can have allergies when you're little, like I did. I've had allergies ever since I was a child, but they've gotten better over time, or they could have gotten worse over time. And so really allergies, unfortunately, can develop at any time, but allergies are, you know, they can be genetic, meaning there is a genetic predisposition. So for example, my mom had allergies and asthma. And so, so, you know, I'm more likely to, and I do. My brother doesn't really have that many allergies. So, you know, it is genetic, but that doesn't mean that everybody in the family is definitely going to get it. So, so yes, so bottom line, allergies can happen at any time. Food allergies can present at lots of different times in somebody's life. The only thing that I'd like to mention about food allergies is that oftentimes allergy and sensitivity is confused. So true food allergy is very scary. It means that that person has those IgE antibodies to a food. And when they have those IgE antibodies, it can cause rapid inflammation when you have food allergies, and that can lead to something called anaphylaxis, which means that your throat can close, your tongue gets swollen, your lungs get super hyperinflamed very quickly, and you can stop breathing, right? And so it's very dangerous, and it's life-threatening. That term allergy is being thrown around when people are sensitive to foods. For example, I can't eat avocados. When I eat avocados, my stomach hurts. You know, my stomach hurts. I feel like just, I don't feel good. That is not a food allergy. That's a sensitivity. You can call it a sensitivity. And unfortunately, we don't have a good test for food sensitivities. Lots of people that are trying to make money and are not doctors, or are doctors and are still trying to make money, push tests that aren't verified for food sensitivities. And that can become really dangerous, because food, in my opinion, is something that is therapeutic. Food should be fun. Food should be something that we enjoy, right? And when we put too many restrictions on food, then it can get really problematic, and something that should be relaxing and something that we need to sustain ourselves turns into a stressful event. And so, so when people are wrongfully diagnosed with multiple food allergies, then I have patients that come in that are avoiding everything. So they go to a restaurant with their friend, and they're sitting there looking at the menu like, I can't eat anything on this menu because I'm allergic to everything. And then all of a sudden, this really nice experience that they could have had with their friend turns into this horrible experience, because then they're sitting there thinking, I can't eat anything. And then they're starving, and then they're trying to sit there and enjoy, but they're not. So, that's something important to remember. Little things like that can turn into big issues, and you don't know it. So, so food allergies are one thing, food sensitivities are another thing. But I actually have another meeting at 9. So I think I'm gonna I'm gonna have to say goodbye to you guys tonight, but maybe, I still have lots of cases I can present. So maybe we'll do a different case next time.
Of course, thank you so much for joining us today. We would love to have you back either for another shadowing session or for maybe one of our diversity panels that are coming up. So yes, we would love that. Thank you so much for spending your time with us tonight. And obviously you're busy and have a lot of things to do, so we appreciate it. And I learned a lot from the presentation, and I thought all of your responses were so personal and so wholesome, and just they touched me. So thank you for joining us today.
I'm sorry. Oh, you're welcome. Thank you for having me. Have a good night, guys.
You too. Thank you.
Safe. Okay. Bye-bye.
For all of my students.
Oh, sorry.
Oh, I'm sorry. For all my students, I'm going to go over a quick presentation to give for a wrap up. And then if you guys have any questions, I'm going to stick around for a little bit after. So if you need support or just need some help navigating the quiz and stuff, I'll be here, and so will my team members. So that sounds good. We're going to get into that. So. Okay, yes. So let's reflect real quick. What brought us to the session today? What are 3 major takeaways that we got from it? And what are some things we want to learn more about? We don't require that you, write any of this down or keep a log of it, but it can be really good to kind of reflect on as you're going through your journey in med school, PA school, like whatever your end goal is in your undergrad. Keeping a log of how you got to that point is going to be really cool to look back on. So we recommend to take a look at these questions. And if you do end up writing something, we would love for you to share it. You can submit your thoughts, reviews, reflections, articles, and success stories to www.payelshadowing.com/blog submissions. And yeah, we would love to hear some of the things that you guys experience. So if you're interested in being a part of Payel Shadowing, you can become a student volunteer or a team member. If you're a team member, you get to be up here with us and also take on some more hands-on tasks. But we understand that Payel students do not always have a ton of time on their hands, so we offer asynchronous volunteer opportunities, and we would love to have you become part of our community and just work with you guys and hear more about your personal stories. So if you want to get involved, go ahead and make sure to follow the links in the chat or go on our website to learn more. So I'm going to humbly ask again, if you can, please donate to our organization. We are a student-led nonprofit, and we work entirely off of the hardworking volunteers from the student executive board and the team members and just anyone who contributes their time and effort. So if you do have $1 or $2 to spare, we would really appreciate it. If not, we totally understand as well. And we just ask that you promote our program, that you share this link with people who might be able to donate that you know of, and just spread the word about Payel Shadowing. So now for the moment we've all been waiting for, how to earn your virtual certificate for attending our shadowing session today. So first thing first, you're going to go and find Dr. Gupta's page on freeshadowing.com, and you're going to, if you don't already have an account, just make a free one through your email on our website, and then sign up for free for her course under her course page. We do recommend that you wait to go onto the website to take the quiz and perhaps do this part if you haven't already, because we're experiencing a lot of high traffic on our website, and which has made it prone to crashes and stuff. So until we get some funding and the money to secure a better platform, we are going to have to deal with that for the foreseeable future. So either A, donate if you don't want to see this problem keep occurring, or B, just be a little bit patient, give about 30 minutes, 45 minutes before you go back and take the quiz. This session is recorded and will be up on our YouTube channel and on our website. So if you do not have the time to go back and take the quiz today or tomorrow or the next few days, you can go back and rewatch. And also the quiz is open indefinitely. So you will get 2 attempts, take the quiz, 30 minutes per attempt, and it's 10 multiple choice questions. All of the questions have to do with what was covered today by Dr. Gupta and was on her slides. There's no like super intricate, detailed information that you need to know. So if you were paying attention, you were here and present, it's pretty straightforward. If you do run into any technical issues or have problems, do contact us at info@freeshadowing.com, and we can try to fix that and make sure you get the certificate you deserve. But once you finish that and you've passed the quiz with a 70% or higher, you can go ahead and download your virtual shadowing certificate, which verifies the hours for today. You'll get 2 hours for this session, and you just make sure to click finish the course in order to download your certificate.
Hi, quick question. Where is the quiz located?
If you go to the professionals page and you click take this course, and then you should be able to go down and just click begin this course. You can select that you've already watched the session, already seen it, and then go to the next tab down, which will be take the quiz. If anyone else is having some problems after this, I can share my screen after the presentation and show you guys how to access it through the website if that's easier.
If possible, could you share your screen, please?
Yeah, let me just finish up those last 2 slides and move on. So as I mentioned, if you did miss part of this session or you want to go back and watch previous sessions, you can go on our YouTube channel or on our website to catch the, oh, thank you so much for dropping that in the chat. You can go on our website or on our YouTube channel and watch our previous sessions. They go all the way back to September of 2020, and you can go back and then take the post-shadowing assessments for these 2 and also get your virtual shadowing hours for them. So we want to make sure everybody has the opportunity to catch up on these different opportunities. So go ahead and check that out. Also make sure you are following us on social media and are subscribed to our email list to make sure you catch our weekday sessions. We are booked until June with weekday sessions. And so that means we're going to be having 5 professionals on here a week, and we hope to see you guys there. So make sure to register beforehand and get those Zoom links. So thank you for joining us today. You have 2 attempts for the quiz, just in the chat. If you have any further questions, feel free to stick around. I'll share my screen and walk through how to go get onto the website and subscribe to the course and take the quiz. So you can go ahead and do that. But anyone else, shadowing session is officially